A transient ischemic attack, or TIA, is often called a mini-stroke. TIA is a condition caused by disrupted blood supply to the brain, which results in neurological symptoms that typically resolve within an hour and often within minutes. The defining difference between a TIA and an actual stroke is that TIAs do not result in a brain infarct or death of brain tissue, while a true stroke does. TIAs are caused by a temporary reduction in blood flow to part of the brain, often due to a small blood clot or a piece of an atherosclerotic plaque that briefly obstructs a cerebral artery and then breaks apart or becomes dislodged on its own. Because neurons depend on a constant supply of oxygen and glucose, even a short interruption can disrupt brain function. Symptoms depend on the brain region affected, but are the same as those seen in stroke. These may include, but are not limited to, sudden weakness, paralysis, or numbness in the face or limbs, often on one side of the body, difficulty speaking or understanding language, blindness in one or both eyes, dizziness, and a loss of balance or coordination. In a transient ischemic attack, these symptoms fully resolve in a relatively short period of time. Because symptoms of a TIA can be indistinguishable from a stroke, a TIA should be treated as a medical emergency. Brain imaging and a comprehensive evaluation are typically used to determine if an actual stroke occurred, and other tests are done to determine what might have caused the TIA. Although a TIA doesn't result in any damage to the brain, the risk of a stroke occurring after TIA is substantially higher, especially with inadequate treatment of the TIA. Thus, patients are assessed for stroke risk and treated to prevent future stroke.